Hi, everyone, and welcome to our first ABA Startup Community webinar. This one is on enrollment and credentialing, and we really appreciate your time today. My name is Erin Mayberry, and I am the Director of Community Engagement at Rethink Behavioral Health. And on the line with me today are Mary Grace DeCaratry, who is our Business Solutions Manager. You may have seen a lot of posts from her in our Facebook group, as well as Kari Gray, who is our Enrollment and Credentialing Manager. We are excited to start a webinar series for you all who are in the startup community. And we are going to be hosting this on Thursdays, the first Thursday of every month from here on out throughout the end of the year. So each month we're going to have a different topic, and we thought that we would start this month with enrollment and credentialing, as that's where you really need to start to get started with your practice. So at this point, I'm going to turn it over to Kari. She has a few slides to go through with you, and she's got a lot of great tips and tricks. And then we'll have a few minutes at the end. If anyone has any questions, you can type them into the questions pane, and we will get to as many of those as possible at the end. One more thing before I turn it over to Kari. All of these webinars will be recorded, and you will have access to the recording after the webinar has been completed. We will also share these in the user group as well. So I will turn it over now to you, Kari. Thanks so much for joining us today.
Hi, thank you so much for having me. Hello, everyone. Welcome to the beginning of the Startup Community webinar series that Rethink has put in place. I am the manager of the Enrollment and Credentialing team here with Rethink, where we work with clients just like you, getting your new practice and your providers credentialed. I've been a part of the credentialing industry for over 4 years and look forward to presenting some tips and tricks for you on your very own journey. Next slide, please. So starting at the basics, what is enrollment and credentialing? Enrollment and credentialing, or E&C for short in our world, is the process of applying to the insurance networks to become an in-network provider. Your providers will go through a credentialing portion with the payers so that they're vetted and meet the payer requirements set for their network providers. After credentialing comes the contracting portion, where the practice or even the providers enter into an agreement with the payer so that the provider services can provide services to their members. Next slide, please, Erin. So why is enrollment and credentialing important? Well, becoming in network with payers allows you to treat their members and receive a set rate of reimbursement for the services that you rendered to their members. Becoming credentialed and contracted allows you to receive referrals from primary care providers, from diagnosing providers, from caseworkers, and among many other types of providers that will work with your potential clients. You'll also show in the online directories with payers so that their members can find you. Next slide, please. So jumping kind of into the nitty-gritty here, setting up your practice. So here are some things that need to be in place. You'll need a legal business name. Choosing a business name can be one of the easiest or even the hardest tasks that you encounter. It's a name that you'll use every day, and it conveys to the public what you stand for. Once decided what your practice name will be, you'll want to be sure that documentation is submitted for your business to be established using that business name and including the full and complete name, which could be an LLC at the end of it, an Inc., a PPLC, whichever designation you are registering for. As you create your business, you'll have set ownership in place. So part of what you have linked with your business name will depend on the type of ownership you choose to designate for that category that your practice falls under. Are you going to be a sole proprietorship or an LLC, a partnership, or maybe even a nonprofit with a board of directors? If it's any type of the shared ownership, you'll want to make sure that you have record of the percentage of ownership per owner documented because documentations will require this for some of the payers that you are wanting to get in network with. If a practice is set up with a board of directors, you'll want to have information for each board member on hand, as payers may also request this. Most of the time, Medicaid programs are the ones or the applications that require more of the ownership information than some of your commercial payers. The next items are your addresses. So where will your clinic be? What address will you be putting on claims? You'll need to have identified 3 important addresses, which may very well be the same across the board. The servicing address is where you'll potentially be seeing members, a billing address for payments to be made out to, and a mailing address. Typically, the billing and the mailing address have to match, but they can be different from the servicing location. The servicing location cannot be a P.O. box. I get asked this a lot, but it does have to be a standard address so that it resembles having a home or a building number and a street name, and then obviously your city, state, and zip. Now your billing and your mailing address, those can be a P.O. box, but for servicing addresses, payers do not allow that. But even if you do not have a brick and mortar, so say you're just a strictly in-home practice where you go to your client homes, you render services there, you will still be required to have an address as your servicing address. So sometimes startups just use their home address or rent a very small office space to use as their servicing address. Just keep in mind this address will most likely be published in the online directories. Lastly, here on this slide, we've got securing a group NPI. So even if your practice will just be maybe yourself as a sole provider for the practice, I still suggest obtaining a group NPI, which is also called a type 2 NPI. That way, as your practice grows and you hire more staff, each provider can bill from one uniform NPI, which would be your group NPI. And you'll hear this a couple times. Consistency from the beginning will save you time in the end. Next slide, please. So you may wonder, what type of documentation do I need to have on hand to apply to the network? So for this, first off, you'll want to, if you haven't already, apply to get a federal employment identification number. You will receive an IRS enumeration letter, or also called an SS4 letter. And this is a letter that will assign you your EIN tax ID number. And it also will list the legal name of the business associated with that number based on the information you entered on the initial application to the IRS. Next is a W-9. You'll want to complete a W-9 specifically for your business, so that you'll put your business name in box 1, as this will be the name that the payers will put on contracting documents. A blank W-9 can just be found online or at the IRS website. The third bullet here is a voided check or a bank letter. Having a voided check or bank letter is important. These are most commonly collected, again, by state Medicaid programs, but you may need them after becoming in network with commercial payers too, to set up your EFTs, which will enable you to receive electronic payments that from the insurance companies that will go directly into your business bank account. Another requirement is a professional liability policy. All insurances require you to hold a PLI. While there are variations on the amounts that the payers will require you to hold for the limits, which would be your current limit and your aggregate limit, but industry standard is $1 million, $3 million. A majority of clinics I've worked with hold a singular group policy that all of their clinicians would fall under, while another option would be to just require your clinicians to hold their own policy. And again, consistency is key. Some state Medicaid programs, they're going to look at all of your documentation and make sure that they match. So does the name on your IRS enumeration letter match the name on your bank account, which matches the name on your W-9? So consistency is really key here so that you won't be required or requested to fix them later. Next slide, please. So continuing to dive in here, we've got a credentialing overview. After you submit applications applying to the network or requesting to join the network, most payers will then begin the credentialing process. Credentialing is the process of verifying a person is who they say they are. So they're going to check their education, their licensure, their certifications, etc., just ensuring the payers that the providers do meet their set requirements for network participation. You'll want to begin the application process as soon as possible, mainly because every payer timeline and process is different from one another. As you can see here on bullet 3, standard timelines fall in the 90 to 180 day time frame. That's 3 to 6 months. So you may be very excited to start your business and begin seeing members, but keep in mind some of these timelines. Some payers do operate more quickly, such as a 30-day basis, while other payers will extend the process to 6 months or so from beginning to end. So get your applications in as soon as you can, and then basically hurry up and wait from that point on. So follow up, my last bullet here, it's super important to follow up with the payers. This is where, you're trying to get your business up and running. So check-ins with the payers may get pushed to the wayside while you focus on other areas of your business. My team and I, we follow up on items we submit very regularly, just ensuring applications are moving through the process, that there are no flags on the file, and that nothing is needed at that point in time. So a clean application submission is always key and will help make the process go smoother and even a little faster if everything is correct on the first go around. Next slide, please. After credentialing, typically comes the contracting step. There are a couple payers that flip-flop this, but for the most part, credentialing will happen first. And then once payers review your applications to join the network, then they'll hopefully extend you a contract for you to review. This is typically a very long document that you get to read through, making sure you either agree with it and you can move forward, or go back to the payer for clarification or changes. Depending on depending on the payer and the size of your practice, this could be a group contract or it could just be an individual contract. Many of the payers have a minimum requirement on how many providers should be on staff. So do you have 2 providers? Do you have 3? Do you only have 1? Some of them, if you only have 1 provider, will not offer group contracts. But in that case, don't panic. You can still get an individual contract for each clinician until your practice continues to grow, at which point you can request a group contract when you meet those minimums for each payer. So you'll want to generate a standard fee schedule for your practice so that you know what rates you'll be billing payers so that you can cover your overhead. Compare those rates with the payer reimbursement rates. That will most likely come in the contract that's extended to you. So if the reimbursement rates are too low, you can request to negotiate rates, but keep in mind that not all payers will negotiate. Some of them will, some of them have requirements where you have to be in network for a certain amount of time. Again, each payer is different. Next slide, please. So these are kind of some tips and tricks here regarding the process, common delays. Since credentialing and contracting can take so long, you'll want to avoid any of these on this list for delays or pitfalls. Obviously, errors on applications will get flagged by the payer, in which they'll have to re-review or reach out to you for corrections or clarification. If you don't respond to these outreaches by a certain amount of time, they can even term the application, and you'll have to resubmit the application and start from scratch. The second item here, a lack of correct documentation. That goes back to those very important documents at the beginning of my slides. So your W-9, your IRS enumeration letter, those type of items. So the third item, provider CAQHs. This can also create delays in their credentialing. If their profile account is expired, if it doesn't list certain information or outdated information, then again, there will be outreach from the payer to you or even to the provider, and that can take time. If you have to respond to the outreach, they can take a decent amount of time to respond back. So any type of communication that's happening during this process will just, it'll make the timeline extend. So this is why my team and I like to maintain our provider CAQHs. We ensure everything is complete in their profiles so that at least the CAQH does not create any delays in the credentialing process. So you'll also want to remain vigilant in checking your email, including your spam folder. Returning contracts and forms to payers in a timely manner are key. Again, if you don't respond within a certain time frame or return contracts within a certain time frame, then they'll void it and you'll have to start from scratch. And then lastly, this can be a frustrating one. You'll want to keep an eye on any expiration dates for your providers, their license, if they have a state license for their specialty, their board certification, and then also for any liability policy, whether it's their own or a company policy. Some payers will actually put processing on hold if an expiration date falls within the next 30 days. So again, that can be frustrating because it's a delay. Even though the license is current or the policy is current, they will continue to put it on hold until you get it renewed. Next slide, please. So finally, what you've all been waiting for is becoming in-network. So as contracts are processed with the payers and loaded, you'll actually receive an executed contract. So that shows both your signature and the payer signature along with an effective date. Sometimes there's a misunderstanding where groups get a contract, they sign it, they return it, and they just assume that they're in network, but it's really not until this executed copy is received that you should wait to assume until you get this executed copy. Welcome letters can also be a part of your welcome package. This could be for the group and even for the provider specifically. As you grow and add providers, then they'll have their individual welcome letters that you'll want to save for your files. The effective dates are when the contract goes live and you can begin seeing members and then billing for those services. Again, each payer is different. Some have effective dates that are in the past. Some will have effective dates in the future, and others will have an effective date on the date that you receive the executed contract. And again, save copies of everything. You'll thank me later, I promise. Next slide, please. As you grow your practice, you'll want to keep in mind a few additional items. So once you hire new clinicians, whether these are BCBAs, OTs, PTs, etc., you'll want to be sure and understand that they also need to go through the credentialing process and be added to any group contracts. Sometimes it gets lost in translation that a group contract covers all clinicians, past, present, future, but this, in a majority of cases, just simply is not true, unfortunately. Most payers state in their contracts or their handbooks that providers need to be credentialed in order to see their members. So this can be a delay as you begin to build your staff if they have to go through, again, that 90 to 180-day timeline with payers before they can see members. So technicians, this is a little bit of a different story. Most payers do not require RBTs to be enrolled. However, keeping in line with the fact that all payers are different, each state can also be different in their requirements as well. So everyone, you'll really want to pay close attention to contracts and handbooks to help guide you on whether RBTs need to be enrolled or if they'll just be billing under their supervising provider. Most, but not all, commercial payers don't require RBTs to be enrolled. One national payer, TRICARE, they are one that do require RBTs to be paneled as a TRICARE certified ABA provider. And then there are, a couple states that kind of fall heavy in the RBT range where they have to be paneled as well. Next slide, please. So keep in mind that getting in network and staying in network are two different things. So you'll want to continue to be mindful of several items here. You'll want to complete any directory verifications that get sent your way. Due to the No Surprises Act that went into effect on January 1st of this year, payers have to keep up-to-date information on file for your practice and for your clinicians as network providers so that there are no hidden out-of-network costs to their members. A lot of times these can go to your spam folder. So again, just make sure that you are checking your spam junk folder regularly. You'll also want to make sure that you follow all contractual policies from that original contract that got extended to you. Follow provider manuals. Provider manuals can be found online with the payer sites. Sometimes they are also found in their portals that they have you create when you're in network. Updating demographics as soon as changes arise. This can be an address update, a provider name change, those things of that nature so that everything is kept current with the payers. Lastly is recredentialing. So getting your providers in network, it is a green light, but not forever. So the recredentialing can take place approximately every 3 years, sometimes 5 for your providers. Each payer is different on the requirements for recredentialing. Some of them have documents that need submitted for this, while others will just go straight to that provider CAQH I mentioned earlier and do their recredentialing based on their CAQH. So you want to keep an eye out for those types of notices. Next slide, please. So congratulations on becoming a network provider. Following those basic tips and tricks will help the process go hopefully more smoother for you, and you'll be able to hopefully have everything in line to get started if you haven't already. And then our last slide, I think we're ready to jump into any questions that attendees may have.
Wonderful. Thank you so much, Kari. I hope everyone really got a lot of useful information from that presentation. We do have about 5 more minutes for anyone that has questions. So if you do, just a reminder, you can type them into the questions pane. We have a couple that came in already, Kari. So I think going back to setting up your practice, when you were speaking about addresses and how a lot of times the billing and mailing address might be the same, but there's also the servicing address. Morris wanted to know, what if there's not a physical address with a clinic, but you're providing services in home or in schools?
Right, great question. There is still a requirement on applications for a servicing location. So obviously you're not going to have, if you're seeing 20 clients, you're not supposed to use their home address as a servicing location. So you'll want to have one set servicing address. And again, this comes in play, and it makes it difficult too for some of the clinics that will be servicing in-home clients because there is no office that they go to. But at that point, to have an address, again, some startups, they use their home address. Obviously, not everyone wants their home address published like that. So there are times when, a small rental or a virtual office can be an option as well. The main thing that you'll want to keep in mind is that it has to look like a standard address. So anything that has P.O. box, that's something that you'll want to stay away from.
Thank you. Another question that came in is when you apply for an LLC, is that applied for locally and can it be done online?
I believe there are websites that can help you, apply as a business to the IRS. And there's different categories, like you said, LLC, that type of thing. So I think I would kind of suggest working with either an attorney. Some clinics work with an attorney directly, or one of those online type of forums that help you get set up as a business. My knowledge, unfortunately, on what an LLC requires versus another type of category is not very deep. But we do see LLCs, we see Incs, we see the PPLCs, so we see a variety of them. Most of the time, I don't think they're state specific as to what type of category it falls under.
If you can answer this question, do you happen to know any provider, or this says providers, maybe it's funders, so Amina, if that is correct, let me know, but which take the longest for the credentialing process and becoming a network?
Sure. So Aetna, they tend to take 6 months. Beacon Health Options, which is a behavioral health specific network, they tend to take 6 months as well. Some of the faster ones, most state Medicaid programs are fairly quick, although you have some outlying ones like Massachusetts. But your Cigna will be quicker, your Anthems and your Blue Cross state programs will also be one of the faster ones.
Thank you. All right, let's see. I don't know if you know this one, Kari, but do you know if Kansas requires RBTs to be credentialed?
Kansas, let's see. I know their Medicaid, I believe, is a little different. Is that specific to Medicaid or just commercial payers? I do not believe RBTs and commercial payers for Kansas have to be credentialed. I'm not 100% around Kansas, around Medicaid.
That's okay, Allison. If you have any clarification about that question, let us know. We have about 1 more minute. And again, Kari, I have one question. If you can answer, that would be great. If not, no worries. But if I initially credentialed as a solo provider type 1 NPI, would it be best to submit a request to credential as a type 2 group? How long could that process take?
So if you are credentialed as just a solo provider, that would lead me to believe you're credentialed under and billing under a social security number, if you're not linked to any tax ID. Now, if the question is in regards to saying if you're previously credentialed with another employment and then you're wanting to move forward with getting credentialed with your new practice, so again, that depends on the number of providers and how you're credentialed. If you're credentialed as a group member with another practice and you are the sole provider with your new practice, you'll most likely have to be extended an individual contract. Again, just due to those minimum type of requirements that payers hold. And so that can be a little bit of a delay, but if you're already individually contracted, then sometimes you can just link yourself to your current tax ID. Linking is definitely something that happens quicker, so that would be the best case scenario, I would say.
Wonderful, thank you. That is all the time we have for today. I know we ran a minute over, so I apologize. I do want to just wrap up by letting everyone know that, again, the recording for this will be available via email, and you will also have access to it through our user group. So if you're not part of the Facebook user group yet, we do have a user group called the ABA Startup Community. So you can find us on Facebook. We provide a lot of resources, including these webinars on there. If you do need enrollment and credentialing assistance, Rethink does offer enrollment and credentialing services, and Kari is the manager of that team. So you will be in good hands based on all the information that she shared with you today. One thing that we are providing for anyone who is getting started, if you are using the Rethink platform, all of those services are 50% off of the listed price. In the email that you receive with the recording link, we will be providing a list of the services that Rethink provides with our enrollment and credentialing team. So thanks again for joining today. Be sure to look in your inbox for that email in the next few days. And just a reminder that this is a series, so we will be doing this again in August, I believe August 4th, where we will have Core Action Consulting as a guest speaker, and they will be talking about tips and tricks with getting started with your ABA practice. So we hope to see you there. Thanks, everyone. Have a great rest of your week.